Hello and welcome to this week's episode of the Africa Within podcast. I am your host, Nontobe Gomlambo. In today's episode, we are talking about primary health care in Africa, which plays a crucial role in delivering essential health services to millions of people, particularly in rural and underserved areas. So in South Africa has a mixed public-private healthcare system where primary health care serves as the foundation of the public health sector, catering to the majority of the population, especially in rural and in disadvantaged communities. And the recently signed National Health Insurance Policy that aims to strengthen public health care also aims to improve universal health coverage. Despite its importance, primary healthcare systems in many African countries still face significant challenges that hinder their effectiveness. So to discuss this topic today, we are joined by Dr. Atiya Mosam, who is a public health medical specialist based in Johannesburg, South Africa. Thank you so much, Dr. Mosam, for joining me today. Could you please talk about yourself, who you are, and the kind of work you've done in the healthcare sector?
Thank you, Nontobeko, and thank you for having me. Lovely to meet you. I am a public health physician, and I have a background in health policy and health system strengthening. I work in various initiatives that span research, policy, strategy, and implementation, ultimately to achieve universal health coverage. And I currently serve as a technical advisor for a range of institutions, from local level health providers and NGOs to national governments of health in various countries, to large global institutions such as the World Health Organization and previously USAID. My work has been involved in various policy reforms and health system reforms, including primary healthcare strengthening, the national health insurance in South Africa and in various other countries, as well as institution of policies such as the National Public Health Institutes. And my passion really is around primary healthcare, which we'll be talking about today, as well as the health workforce, digital health, and financing for healthcare.
Okay. Could you please define what primary healthcare is and why is it essential for Africa?
Sure. So primary healthcare is really the cornerstone for a universal health coverage and for a resilient health system. Now, what many people may perceive to be what primary healthcare is not really what it should be. So a lot of people know primary healthcare as that medical model where you go as a patient to a facility and you tell them what is wrong with you, and they treat you or give you medication. But it's really very much broader than that. It firstly looks at the patient as a whole, so tries to look at them across a continuum of care, and I'll get into what that is shortly. But it also is very steeped in communities and uses communities to engage with the concept of health and to understand what healthcare is needed, and is quite embedded in the whole of society, and so brings together the whole of society in order to bring health to these communities. So you could say that it is quite deeply woven into the economic, the political, and the social context of very important understand it, and I'm going to unpack these a little bit. The first, as I said, it relates to communities, and so it is very context specific. So, for example, the type of primary health care that you may deliver or you may organize in Shawelo in Soweto may be very different to the primary healthcare that is needed for inner city Hillbrow, for example, even though they are in the same metropolitan. And so it very much depends on who the community is, what their needs are. It also involves them not only in understanding their needs, but also in what interventions should we deliver, how should we deliver them, how is the community involved in that delivery. So it is very much at the local level. But if you're going to be doing that, then you also need, as I said, to bring together the different sectors of society. So you
Yeah.
can't have primary health care. For example, if you are in inner city Hillbrow, and as you may know, because you also in Johannesburg, we've been having water issues, right?
Shortages.
A lot
Yeah.
of the time, people do not have water at their houses, and
Mm.
so you need the Department of Water and Sanitation. You need the Department of Education if it's got to do something around drug use in schools. And so at a local level, you need all of these stakeholders to be involved to ensure that health is delivered, or that health is seen to, not just only by the health sector. So that's sort of the broad context around primary health care, taking into account,
Yeah.
the other aspects of society. But then obviously you still need the facilities and you still need to deliver care. And so, but how that differs from what we have at the moment is that, okay, as I said, it's across a spectrum. So it's not waiting for people to come to you when they are ill. It is taking a
Mm.
prevention approach. So making sure that we go and screen people, we vaccinate children or the elderly for flu, etc., and ensure that they are kept healthy. They are detected. If they have a problem, it's detected early, and then we keep them as healthy as possible, even if they do have a health condition. And then, in order
Yeah.
to do that, we need a range of healthcare workers and allied workers. So, not just your
Yeah.
nurses that we used to, but people like social workers or the dentist or a community health care worker who can
Yeah.
all help you to see this patient in a holistic manner. I want to just tell you a quick story that will highlight this. When I was a junior doctor, about
Yeah.
15 years ago, I was working in Mufulo in Soweto. And, you know, if you've ever been to a public sector facility, you'll know like at 3 o'clock, there's still masses of people to be seen.
Yes.
And I was trying desperately to, sort through everyone, send people who, needed to be seen to my colleagues, send the people who just needed the pharmacy to the pharmacy. And
Yeah.
the gentleman came and he stood in front of me, and I was I looked at his file, and he was very like well dressed young gentleman.
Yeah.
So like with my biases, I thought, oh, okay, well educated, got a good job. And I saw
Yeah.
that his sugar level was really high. And
Okay.
immediately, medical emergency, he needs to go, be referred
Yeah.
to another hospital, etc. And so, like, in my now overwhelming irritation, I was like, why didn't you take your medication? And he said to me,
Mm.
I don't have money for food. Now, if
Oh.
you know about diabetes, you'll know that if people don't eat and they take their medication, they are in danger of having their blood sugar level drop.
Oh.
So, um, in a in a proper primary healthcare setting, that wouldn't have happened, because you would have had a community healthcare worker who would have helped to follow him up at home, maybe
Mm.
follow him up in a way that he wouldn't have to maybe choose between transport money and money for
Mm.
food.
Yeah.
They would have connected him with social services to
Mm.
be able to get, food parcels, etc. So, not to say that that isn't there, but it's not at the level that we need it. We are not as proactive with our patients, and so that is what primary health care is, and it is really the first point of care for many people, and that's why it's so important that we get it right.
Yeah. Okay. So now you've described what it is. What are the challenges that the continent faces in the primary healthcare, or what is the state of primary healthcare in Africa?
Hmm. So the biggest challenge, and this will underpin all the other challenges I'm going to unpack, but the biggest challenge is that it is under prioritized and
Okay.
undervalued. And that is
Uh,
not only by the policymakers and the Department of
yeah.
Finance or the Department of Health, but even on the ground by healthcare workers and even by patients who don't see it as a valuable system. So
Mm.
positive, and not to say again, there are primary healthcare systems, and there's areas where they are doing primary healthcare well. For example, Botswana. prior to Botswana having a this HIV epidemic that they had to deal with, they had a really
Mm.
robust primary healthcare system that was steeped in the community, and they worked with these village
Mm.
health committees, etc. But the HIV epidemic came and sort of ravaged their system quite a bit. But
Mm.
and South Africa does have a strong system in terms, if you think about, we have facilities, etc. But
Yes.
like it's undervalued, it's underprioritized, and it's not done in the true primary healthcare way. It's more about just delivering services to people. So, because it is underprioritized, the first challenge then, and as we know, whether it is at a government level or even as a me and you level, if you don't prioritize
Mm.
something, you're not going to spend money on it.
Yeah.
And basically, we don't have funding, and how that plays out is that then you don't have enough funding maybe to put up facilities, or if there are
Mm.
facilities, the infrastructure is broken, it's not maintained well, there
Yeah.
isn't enough equipment, enough medication, and it just doesn't become a nice environment for people to want to seek care, right?
Yeah.
And related to that is then the workforce. So, firstly, you may not have enough people in primary health care. So,
Mm.
you know, in certainly in South Africa, they are much more healthcare workers. Firstly, in more specialized services, so we have lots of specialists as opposed to general practitioners and your primary healthcare workforce. Most of them are sitting in the private sector as opposed to the public sector. Most of them are sitting in the urban area as opposed to the rural area, and so you have these imbalances, right? And
Mm.
so the primary healthcare system, especially in the public sector and especially in rural areas where your primary healthcare clinics may be not just the first point of contact, but the only point of contact for people, right? That's the
Mm.
only thing that they may get because there's no hospital near them. And so if you don't have healthcare workers, those services are not going to be rendered. Either they're
Mm.
not rendered well or they're not going to be rendered at all. So that's the first issue. And then the second issue is around, again, like I said, because it's not seen as valuable, we don't actually train people a lot on primary healthcare. So if you look at like training, undergraduate training, in
Mm.
medical fields, people, graduates get about like only maybe less than 20%, if I think about my training, of their time on primary healthcare, right? So you don't see it as a necessary part of the system that you need to know and engage with, right? And that causes a bit of a feedback loop where you don't see it as necessary, and so you don't go into that field. And
Mm.
then they are the resource, and then when people go there to train, they're like, "Oh, this is a terrible place to be training in," and it just perpetuates that cycle. So.
Yeah.
I don't know if you've heard about it's a bit of a contested issue, but we have the Nelson Mandela Fidel Castro program where our
Cuba
government,
Prince.
yes, the Cuban program, where we send people to be trained in Cuba because
Mm.
we need more doctors than we can train. And a lot of people, say that these doctors are not ready for the South African system, and
Mm.
they're not well trained, etc. But the distinction is that Cuba is very primary health care and community care centered. So they've been
Yes.
trained for that context. They
Okay.
haven't been trained to work in specialist hospitals the way we have been trained.
Mm.
Studies have shown that these doctors are more connected to communities. They're more likely to engage with primary healthcare in the way it's supposed to be done. They are more
Yeah.
likely to work in teams. And so, if we learn from that, that means we need to start changing our training to ensure
Yeah.
that there is better training on primary healthcare so that people may want to go into primary healthcare because they see
Mm.
value in
Yeah.
it. And then the last part, I think the last challenge is around actually accessing services. So
Yeah.
when we talk about access to services, we first talk about whether the services are there. So,
Mm.
generally, South Africa tries to have, a clinic within 5 kilometer radius of everyone. Um,
Mm.
That's not always the case everywhere. Rural areas may have challenges, so they may need,
Mm.
mobile outreach. That is definitely the case in many African countries where, you
Yeah.
need more community-based mobile services. Another aspect is affordability. So in South Africa, services are free at the point of care. So you
Mm.
don't have to pay for primary healthcare services, but that doesn't mean you don't have to pay to get to the services.
Yes.
So, you might need money for transport, or you might
Yes.
need to pay the cash to look after your child for the
Mm.
day. So, those are the things that need to be dealt with to bring services closer to people, so they don't have to pay out of pocket to go and get services. And then the last is
Mm.
about, we don't talk about this a lot, but it's about the acceptability of services, right?
Mm.
Is, like I said, if your infrastructure is failing and you're a patient and you go and you sit in this long line, and then you go to the bathroom and there's no water, and the healthcare workers are all overworked and burnt out, and so they don't spend enough time with you, or they would. That's not a nice situation.
Experience. Yeah.
It's not a
Yeah.
nice experience. And so these are the type of things that we need to think about when we are thinking about, the challenges of primary healthcare and why people don't
Mm.
actually access the services, even though they are there. So, and if I can just give a little bit of a plug quickly. So some of my work is around this. We are actually looking at ways to measure at a population level, how people are accessing care and why they don't access care in terms of
Mm.
affordability and availability and accessibility, so that we can make better decisions based
Mm.
on the data. So if people say, well, I don't come to the clinic because people are rude to me, that is something to take on and to do something about. But until we
Mm.
measure something, we have an idea about it, we're not going to be able to do something concrete with it.
Yeah. Yeah. You spoke about community health care workers. I want to include this on this question. So, according to the World Health Organization, 80% of the continent's population relies on traditional medicine for
Mm.
their basic health needs. So, what role do traditional medicine and community health care workers play in primary health care?
So that's an excellent question. I'll start with the traditional, what do you call it? Traditional healers or traditional
Yeah.
practitioners, yeah.
Yeah.
Um, as you say, they're quite an integral part of not just like African culture, but quite a few cultures in the world, right?
Yes.
Have, whether it's a religious healer or a traditional
Mhm.
healer. And for most people, whether it is, a financial reason, or whether it is just purely from a, acceptability, again, you rather go to the traditional healer than to sit in a queue at the clinic, or whether
Yeah.
it is just a preference because of belief systems. A lot of people access these practitioners before they come to the traditional, to a, formal health system. So
Yes.
they are an important part of health, even though they may not be part of the health system. They're an important part of keeping our communities and our population healthy. So we really do need to engage with them, um, to better, I think they need to better understand what happens in the health system, and we need to better understand what
Yeah.
happens in their system, so that
Mm.
firstly we can optimize health for people, because not they are, we know, as more and more studies are emerging, we know that certain traditional medicines do work, right? There's
Mm.
always, like, whether it is, your granny's recipe for ginger or whatever soup when you are
Yeah.
sick, some. So there's definitely, roots and rationale behind a lot of it, but we have to firstly understand what it is, and then we
Mm.
also don't want our patients to be inadvertently compromised, because maybe there's for example, an interaction between something that they're taking from the traditional practitioner and then a
Mm.
medication that, like, a doctor is giving them. And so, we need to engage with them, we need to understand better, and then find ways of, like, integrating them within the system, so they're not separate. I mean,
Mm.
they are part of the way the system functions, and there's mutual understanding, and we can grow the practice, or the mutual practice together.
Yeah.
With regards to community healthcare workers, they are really essential and important, as I said, in actually getting services to people in their communities, and then linking them back to formal services in the health facility. So and there's such a wide range of things community healthcare workers could be valuable in, whether it's educating. We saw during COVID-19, they were, instrumental in educating communities and helping to find cases, etc. We know that they can do basic screening and care, so they can, test
Mm,
people for, um, screen them for diabetes, etc. And they also can, then refer them back to facilities if they pick up something.
mm,
So they really do have a vital role within the health system. The challenge with community healthcare workers at the moment is, firstly, because people see them as useful resources,
yeah.
we throw everything at them, and indiscriminately, like we want them to do everything.
Yeah.
But sometimes they don't even have a formal role. They're not formally paid within the system, and
Mm, yeah.
your benefits. There isn't career pathing for them. You're a young person who is a community healthcare worker, and you want to ultimately be a doctor or a
Mm,
physiotherapist. There isn't that career path that says, we will train you to be able to get into medical school, etc. So we
mm,
really need to do more to make them a formal part of the health system,
mm.
because they are so valuable in what they can deliver.
Yeah. You spoke about COVID-19 and how essential the community health workers were during that time. And we all remember the devastating effects of COVID-19 and how it overwhelmed the systems, like even in developed countries and in developing countries. What then are the lessons that we have learned as Africa from that experience of COVID-19, and how can we strengthen primary health care?
Mhm. So yeah, I think there's been a myriad of lessons. I think if I had to distill it into just two, is that we've seen that through COVID-19, we've seen that especially the primary healthcare system has two roles to play in these public health emergencies, right? The one is to continue to give care to the people who still need care, because just
Yes.
because there's COVID doesn't mean I don't need my diabetic medication. Uh,
Mm,
but then also to be part of early detection and community surveillance, so that you can pick up these emergencies early and you can respond, right? So from the first part, from the managing health systems for regular routine care, there were a few very interesting interventions that showed us the need for the health system to be very resilient and be able to pivot very quickly. So for example, we had to do either institute new ways of picking up medication for people. They put up pickup points, or they had to decant them to like other pharmacies, etc. We needed to find ways that people could get routine vaccines, especially your babies. You don't want to bring them to the
mm,
facility, for example. How do we go out into communities and find these babies? Then there was a range of digital interventions that came up, either to provide people with consultations, so that they didn't have to go to a facility. They could phone and get advice on their symptoms, or apps which give information on symptoms, etc. So there was a range of lessons about how we need to think about moving your delivery model away from just this facility. Like, how do you
mm,
take it out to communities? How do you use your private sector? How do you use your digital health interventions, etc.? So that was lessons around maintaining your systems. And then we learned a lot around, early detection and response. So again, back to community healthcare workers, they were
mm,
vital in going out. South Africa used them a lot to go and screen people and to give,
mm,
health advice. I remember 2 years ago, I think, I was in Tanzania, and there was a community healthcare worker who was from a rural part of Tanzania, who, if I remember correctly, received the award for detecting and reporting a case of Marburg virus
Wow.
early
Okay.
on authorities, and prevented, a sort of outbreak because it was detected early, etc. And so that just goes to show that, even a community healthcare worker with limited resources in a rural area can have
Yes.
such value to detecting, because they know their communities. Going
Mm.
back to primary healthcare being community based, if you know your community and if your community is aware of, what can be expected. I know COVID-19 kind of hit us all unexpectedly, but there are communities where, for example, Ebola is a regular
Yeah.
occurrence.
Mm.
Then you can assist your communities to be aware. Your community healthcare workers can be trained to know what to look out
Yeah.
for. And those are some of the, the lessons we learned around how we can use your community structures and your primary healthcare system to ensure that you have this early detection. Um,
Yeah.
in terms of the second part of your question around, what can we do to strengthen the systems, I think firstly, like I said, education and awareness. If you know
Yeah.
your community, you know what to give them information on, what they know what to expect, what are the symptoms or the potential outbreaks in their areas. And then, like I said, we invest in early warning systems and community surveillance, so that you're not waiting for someone to come to a facility to say that they are sick. You are detecting them early. But then once they are detected, you also want your primary healthcare system to be able to rapidly diagnose them. So they must have like the laboratory tests. They must have proper PPE, supply chains for their medication, and then ultimately at the end of the day, we need, I think, one big lesson is around the fact that a lot of healthcare workers, especially there's healthcare workers who work in areas that deal with outbreaks
Mm.
regularly. A lot of healthcare workers are not in that context, and so they were caught unaware. There was a lot of anxiety around it, and so we need to ensure that our healthcare workers, especially at primary healthcare level, are trained not just on like primary health care, but around that interface between public health emergencies and primary health care. And there's one of the organizations that I work with. They are implementing a intervention called epidemic ready primary health care, and they've recognized that these healthcare workers are at the coal face, and they
Mm.
are the more than the public health people like me, who had sort of former public health roles, who dealing with policy.
Mm.
We are not the ones there when things actually happen. We still busy doing policies and implementation, etc. These are
Mm.
the people who are faced with it, and so they need to be trained. And so this initiative is training healthcare workers and mentoring them in different countries across Africa
Yeah.
around making sure they are connected to the communities, because a lot of healthcare workers they serve the community, but they're not integrated into the community or connected to them. So connecting them to the community, from a clinical point of view, enhancing their ability to detect potential disease,
Yeah.
etc. And then when that happens, to protect themselves, protect their patients, protect their colleagues, and
Mm.
then continue to deliver services, but in with this lens in mind that that there is public health emergencies that they may need to address. So I think, for me at least, it does start a lot with ensuring that your workforce, who is at
Yeah.
the front line, is well equipped for what they need to do.
Yeah. So with all these challenges and all this training that needs to happen, and to improve all these systems, how does or how is technology, things like AI, digital records, how is it improving primary healthcare?
So I think we can all agree that digital health has potential
Mm.
to improve access to care, and sometimes quality of care, etc. If you know you have access to like good information, etc. But I think what we need to be careful of is that we mustn't see it as a panacea or the silver bullet for everything. Digital
Yeah.
health is one modality of delivering services, right? So it's the same way you have community healthcare workers, or you have, mobile buses that go out. Digital health can provide another platform of care. The reason why I'm saying this is because a few years ago I did a intervention where we had a telemedicine doctor call diabetics who were not controlled, and she used to call them daily and monitor their glucose levels and give them advice, etc. And we had really great outcomes. So from a clinical point of view, patients really, they did really well and their glucose levels were controlled, etc. But where we had some really interesting lessons was about some of the assumptions we made. So for example, we assume that if you have a clinician phoning someone, they will, this will be much better, especially if you're working, right? Because then you don't have to go to the clinic comes to
Yeah.
you. But many people, for many reasons, didn't find that suitable, because maybe maybe you work in a call center and you can't take a call, and like everyone's around you, or
Yeah.
maybe your boss doesn't like you taking personal calls during work hours, right? And so then you need your telemedicine services to also have after hour times, because people then don't want to access it during, so you're not really helping people. Then for example, a lot of the population, because this was a public sector initiative, a lot of the population, maybe they don't have money for data, so they can't WhatsApp you if you ask them for something. Or
Okay.
maybe, your elderly population, maybe they don't know how to use, the WhatsApp, or
Yeah.
they can't hear well on the phone. So they can't, you can't really engage with them because they can't hear you at all. So
Yes.
you know at the end of the day, there's definitely scope for all of these, but you have to, and back to the community, you have to understand your
Yeah.
community and understand how best to deliver that intervention for them.
Yeah.
And then from a healthcare worker point of view, what is very interesting, and this didn't come specifically out of this intervention, but it's from readings that I've looked at, is that healthcare workers are very used to seeing people face to face. And so there's a lot of maybe anxiety around, did I do the wrong thing? Did I see the wrong thing?
Okay.
Not used to this over the phone, where you may not be able to see people properly, you can't examine them. So you have to train, again, back to training. You have to train people, make sure that they feel psychologically safe with this mode of, and that goes for anything, right? If you send a doctor that works in an urban area out into a rural area where there's no support, you have to train them for the context. So again, to the point, it's a really great way of us improving access, but we have to look at it for both its, challenges, as well as the potential, impact it can have.
So, you and I live in South Africa, a country known as the most unequal society in the world. How can other African countries like South Africa ensure equitable and affordable health care for all?
So, yeah, South Africa, as you say, is the we are the most unequal country,
Yeah.
and I do think the primary healthcare system, especially for health, is a big step that we can take towards achieving equity. There's a few things that need to be done, though. The first, as I said in the beginning, is we need that political will and the prioritization of primary healthcare, and even at a local level, we need that change in attitude from both patients as well as your healthcare workers, because if patients don't see your primary healthcare as valuable, they're not going to want to go to the services, nor do they want to they won't demand better services.
Yeah.
And so we need that prioritization and change in attitudes. Not necessarily as big a problem in South Africa, where I say, services are free at the point of contact, but in many countries, services are not free. We need to change our financing models to provide free primary health care. As I said, we look at ways to get healthcare to people so that they don't have to worry about the cost of getting to a facility. Um, we need to start integrating well. You know, what happens in a lot of countries is that the private sector springs up to fill the gap, right? And a lot, we know this in a lot, even in South Africa, a lot of people will go to a private GP unless they have like a chronic problem and they really can't afford to go to a GP all the time. But if you have a flu, more likely you're going to go to a private GP than sit in the queue at the clinic, right? And so we need to start integrating those parts of the health system together so they work as one. And they, again, it needs to be funded by government so that people are not paying for a private GP out of their pocket and then choosing over healthcare versus food, as I showed you in, in the experience I had. And then, like I said, we need to train healthcare workers better on primary healthcare, more on primary healthcare, and need to train them in a way that they understand how to work in that integrated manner with other, providers, with departments of water and sanitation, with all of the elements that primary healthcare needs, so that they all go to function not just in that I wait for a patient and then I treat. They need also start looking at a patient holistically and making patient management plans that are in accordance with what the patient needs in its entirety.
Yeah.
So, the universal health coverage topic has been a hot topic for a while. What needs to happen to achieve universal health coverage through primary health care?
So, like I said, primary health care is the cornerstone of universal health coverage. If we can really prioritize, and I know it's not exciting because, as having robotics for heart disease or having people operate via virtual platforms on someone in another country, but it really is the system that can keep your population healthy and ensure that when they do get sick, because even though we can address all of the social elements, etc., your body is your body, and as you get older you may be inclined to disease. And so when that happens, we do keep people as healthy as possible even if they do have an illness. And so primary care really is, if instituted well, is the system that can achieve all of that and can ensure that people are covered in terms of ensuring that they get the services that they need. And then we can stop spending so much money on expensive, complicated care, because you would have detected diseases early, you would have kept people healthy for longer, so that money can then be put back into primary health care. So if we really do want to achieve universal health coverage, we do need to focus on what our primary health care systems look like and how we can strengthen them.
So another hot topic, has been the USAID funding cuts. As a public health medical specialist, how do you think this will affect primary health care systems in Africa?
So, different countries have received, development assistance or foreign aid for various things. In South Africa, a lot of it was for our HIV/TB program, because we are one of the biggest HIV burden population in the world. Similarly, Botswana. In other countries, for example, Lesotho, Eswatini, they may have needed it more for basic services, etc. Some countries, the money would be just for technical support at policy level, etc. So there's obviously a range of arrangements that were in place. I think it will, and it definitely has impacted a lot of countries in terms of delivery of services. I know in South Africa we did have a range of workforce, especially for TB and HIV, who were paid by this development assistance, and so there's those systems that now have been impacted. The other ways that it will impact is, even if, say, for example, even if South Africa does, our public sector does manage to employ all of those people who were on development assistance and continue the services. Like I said, there are other countries who were very dependent on
Yes.
services, and for example, TB is a public health issue, right? So if someone is not receiving the services around TB in their country, and for example, they come to South Africa for whatever reason, it becomes a public health challenge for us, right? So we can protect ourselves, but we have neighbors, we have people moving in and out. Our community, the global community, is highly mobile, so it has these impacts. But I think this hopefully is a wake-up call for countries, that their governments need to start prioritizing healthcare. And there is a recommendation that you should be spending about 10 to 15% of your GDP on health, right? And many countries don't achieve that. So there needs to be some reflection at a country level about, well, where are we spending money, and is should be prioritized. And so, how can money be shifted from where it is maybe not needed, whether it is, I don't know, military expenditure for whatever reason, and rather shift that in. So I do hope, firstly, that governments will do that. But I think there's also the lesson to be learned that you shouldn't be completely dependent on donor support, but B, if you are, you shouldn't be dependent on one source of funding. You should, and hopefully, and we've seen, other funders, other countries have stepped up now to help plug the gaps, but there really should be some reflection on who we or how we diversify the funding sources for a country. And then the last thing is the fact that even if there is development assistance, whatever is happening must be integrated into the system of the country. You shouldn't be funding a standalone clinic that, if all of that funding is gone, that falls. It has to be, you have to be funding in an integrated manner that is aligned with the agenda of the country, so that if that funding is taken away, the country can still continue to deliver what it needs to.
Yeah. Okay, thanks for that. Last question. What message would you like to share with policymakers, healthcare workers, and general public about primary healthcare?
So I'm going to sound like a broken record here, but I'm going to say, I think basically to your question just before this around UHC and PHC, but policymakers, investment into primary healthcare is investment into universal health coverage and to a resilient health system for public health emergencies. So they really need to start prioritizing public health, funding public health, and ensuring that it is seen as an essential part of the healthcare system. For healthcare workers, I know or we don't sometimes see ourselves as advocates, but we are advocates for our patients, we are advocates for ourselves. And so if you are part of the health system, you should be advocating for better primary health care. If you're working in primary health care, you should be advocating for better resources with which to do your job. And then finally, and I think most importantly, it's the patients themselves. And I said, health starts in communities, and primary health care is supposed to be community-led. And we need communities also to see the value of primary health care and to advocate, because if they don't demand for those services, we know that's how politics works, right? It's only when there's, certainly in South Africa, there's only when there's strikes and toys that something happens. So we need people to advocate that they want those primary health care services. And I think sort of the underlying, or my final message would be that healthcare is, like I said, a pathway to universal health coverage. But as you spoke about in terms of equity, it's the pathway to health equity. We shouldn't see it just as, oh, we need to do it to achieve universal health coverage, or we have to do it just to achieve, the SDGs or any policy goal. But it really is, I think, a moral and a social imperative at the end of the day. If you are going to be led by equity and you want to do right by the dignity of people, then you have to have a robust primary healthcare system.
Yeah. Okay, thank you so much. We have come to the end of our conversation. Thank you for taking time to talk about this important topic on primary health care.
Thank you, Nantubeko. This was lots of fun.
Thank you.
We say a huge thank you to Dr. Atiya Mosam for having this conversation with us, and thanks to you for listening. See you next time.